be kind to yourself. Like, you are doing better than you think you are, and just try not to like compare yourself to others, and just try to be better than you were yesterday.
Hi, I'm Natasha Gillis, and here's a little secret. One of my favorite things to do is drive around town and proudly point out each dental practice my firm has helped grow. Because behind every practice is a real story of grit, vision, and entrepreneurship. On this podcast, you'll hear those real stories straight from the dentists who dared to build something of their own. So tune in, get inspired, and remember, your practice is my passion. We are here this morning with Dr. Amiri. Hi, doctor.
Hi, how are you?
It's great to see you.
Great to see you too. Thanks for having me.
So, your practice, Advanced Dental Center of Germantown.
Yeah.
It's a really unique practice because it's you and your mom.
Yeah.
Tell me about your dental journey. How did you get here?
Yeah, so I kind of grew up around the office. When I was younger, I would run around and be there a lot. But surprisingly, I didn't really want to go into dentistry right after. I went into business and I kind of did a little bit of finance. So when I graduated college, I actually did a year of finance.
Interesting.
Yeah, but then I realized I don't really like being behind a computer, at a desk. I wanted to kind of be a little bit more hands-on, and work with my hands and move around. So that's when I kind of revisited the idea of dentistry. And when I dived more into it, I realized it's actually a pretty good fit for me because it combined art and health and science, and it was things that I enjoyed. So yeah, I kind of just went back into the dental route, and I was really happy with it. I really like it so far.
So you are joining your mom's practice, and now you're taking the helm as a business owner. How long ago was she in practice that you remember walking in?
Yeah, she started her practice.
Don't age her, though.
I think she started the practice in '98.
Wow.
So I can remember as probably as soon as I was even 7 or 8, I would be around the office. And she started much smaller. It was a 3-chair practice. And then a few years ago, we expanded to a larger space. So yeah, I could remember I had these little finger skateboards, and I would play around the office. And our office manager, she was with my mom since the beginning, so I'd always bug her, and I'd bug everyone. So it'd just be a little menace running around the office. But
That's so sweet.
It was fun. I think she talked a lot about me with the patients, and they saw me, a lot of them who've been with her since the beginning. So it's actually kind of cool seeing them now, and they're like, oh wow, you're the daughter, you grew up and here you are, and you're taking care of me now. So it's a pretty cool full circle, I would say.
That's awesome.
Yeah.
So tell me a little bit about your practice. What's your favorite thing to do behind the chair?
Yeah, I really enjoy, as far as dentistry, the cosmetic work. I do a lot of Invisalign too, which I really enjoy. And we also offer Botox and fillers, which is actually I'm getting really into it, and it's been just super fun. Not just working in the mouth, but working on the face and everything too, and just making sure everyone gets to that beautiful look that they want, both their smile and their face. It's been really fun.
So let's talk about Botox, because that's always a fun subject.
Yeah.
For ladies, are you seeing women start earlier? Do you see any sort of trends in this field?
Yeah, definitely. A lot of people are doing more preventive Botox. So they may not necessarily already be showing wrinkles, but they want to start earlier to prevent those wrinkles from forming, which is nice. It's fun. I feel like Botox gives you a nice glow anyways. So yeah, I've definitely been seeing like people start a little bit younger. Yeah, and then as far as fillers, like I'll do a lot of lips, which is fun. So everyone's kind of looking for those, like those plump lips, but not really to the point where like the duck lips where it looks really big, but they just want it to be like a nice where it matches their face, like voluptuous, but still like kind of natural. I think that's like a lot of my patients I get, they want a little bit more of like a natural look.
I feel like fashion changes, cosmetics change, people's perspective of beauty changes. What was it? What was it called? The lip flip for a while was popular.
Yeah.
They had all these different words for different things, and it was basically to augment. And now you're saying it's more of a natural augment as opposed to...
Yeah, I'm seeing a lot of that. Like I get a lot of patients who come in and they're like, you know, I don't want to look like a duck. And I'm like, okay, yeah, we can prevent that. But then, you know, you do still have, it's just kind of like what the patient wants. Like you do still have some people where they're like, I don't want my face to move. Like I don't want to show any expression. Like I want it to be frozen. And, like I want to get my lips as big as I can or things like that. So, yeah, it's just kind of catering it to like what the patient wants. But yeah, you do kind of like go through those trends. I would say like every couple of years, like what's in, what's not anymore.
That's true. And men, are you seeing an uptick of interest with your male patients?
Yeah, definitely. The Botox is becoming less of a stigma, like more of a thing. I always say like, why shouldn't men like be able to take care of themselves and feel good and look good? Yeah, I actually have like one of my friend's brothers, he flies in all the way from Toronto, like just to do his Botox, at the office. So yeah, it's like kind of fun to see that trend and like men just feeling like more confident about it and feeling good with how they look.
That's awesome.
Yeah.
So speaking of Toronto, I follow you on your Instagram and it's a lot of fun. What is your handle? Because I don't have my phone on me.
Yeah, it's Dr. Dr. _Amiri _DDS.
DDS. And you're always traveling.
I'm traveling a lot.
So after, I always see pictures of you in the office, and then I see, oh, she's out of the country.
Where is she
How
today?
does she have time? Where's Waldo?
Where's Waldo? Yeah.
So tell me some of the places you've been. Let's start there.
Oh, a lot of places. I've been to South America, I've been to Ecuador, like Central America, South Africa, a lot of countries in Europe, even Asia. I've been to Iran. That's where like my family's from. So even Australia. So I think I've touched on pretty much every continent. I still have to go to Antarctica. That's gonna be my last continent to hit. But yeah, I really enjoy traveling and seeing people and different cultures, and it's just always an adventure. I love it.
So do you travel by yourself or do you go with groups? How do you manage that?
Yeah, usually I'll go in groups. Yeah. So either like a trip with my friends. My family likes to travel a lot too, so I travel with my family too. I think I've only taken like 1 or 2 mini solo trips, if I can remember. I think I went to like San Diego by myself for 3 weeks, which was not that far. And then I went to Croatia for like a few days. I was by myself before my family joined me, but usually I'll travel in a group.
That's awesome. Yeah. So when I was stalking your Instagram, I saw something really compelling. It was New Year's Eve or like a few days before. This was probably about a year or 2 ago, so it wasn't anytime soon. And you posted something to the effect of, and I can't remember exactly the words, but this year my goal is to stop making goals. Something to that effect. Like I'm going to stop focus on doing and just be. And then I saw all of those travel posts come out, and it just seems like, oh, tell me about that. I mean, that's a really strong and brilliant thing to say, is sometimes we have to know when to stop.
Yeah. Yeah, I think New Year's, I always try to like reflect on the past year or the new year coming up. And I just realized that year that I felt I was just checking boxes off. It was like more of like a to-do list. As someone who, I am like a high achiever, I am ambitious, but I felt like I don't want to just feel like that. So yeah, I was like, why don't I just step back and not have a to-do list of things to achieve, and let me just see where the year goes. I just kind of want to like experience, and not have those larger goals. And it was actually really good. It allowed me to be a little bit more like in the present rather than continually thinking of like, okay, I achieved this goal, like what's next, what's next. When you're kind of doing that, at least to me, I have a harder time like enjoying the company I'm around, or like what am I actually doing at this moment. Sure. So yeah, and actually it was kind of like ironic because I think once I allowed myself to like step back and just do the experience, like just travel and see where like work takes me and things like that, I was actually kind of like maybe achieving a little bit more of what I wanted personally, and than I would have if I was just like checking boxes off without so much like pressure on myself to, be at this level.
I mean, that's a great perspective to say, I want to exist, I want to be. I want to stop focusing on the next, because as you said, you're not giving yourself that credit of saying, hey, I did this. It's more like, okay, next. Yeah. It's like a conveyor belt.
Exactly. And I kind of felt like I was doing that in life, like whether it was like, okay, I finished college, like now let's finish dental school, let's finish residency, let's like do this at work. And I feel like if you keep doing that, at some point you get to a point where you're like, okay, I kind of did everything I wanted to check off, but like, what was that journey of getting, it's kind of like cliche, but it's like you want to enjoy the journey and not the destination. So it's like, how did what allowed me to get here, and kind of, yeah, you want to kind of like stop and smell the roses and stuff. So yeah, I'm trying to do like more of that, just kind of live in the moment, and not have as many like set goals, like I have to get here, I have to do this like within this time period, and all of that. It takes a lot of pressure off of you, I feel like.
Absolutely.
It's nice.
That's what I'm going to try that. Yeah. We're going to reset our mindset and try that for a change.
Yeah.
So you're traveling.
Yeah.
You're living in the moment.
Yeah.
I have to ask, do you feel like, other than just being able to refresh and recharge, because we talk about this often, professionals get to a point of burnout or sometimes close to burnout. Doesn't mean that you've gone over, but how do you feel like that's helped you? Because I feel that positivity coming from you, that peace, and I'm kind of curious, maybe it's some rest and relaxation that you built into the process.
Yeah, 100%. Yeah, as you know, like with our professions, like you do get burnt out after a while. It's always, and especially with like running a business, it's not just with like the client care, like you also have to lead and manage people and just make sure the business is running fine. So yeah, it can lead to a lot of burnout, and just always on the go. So yeah, it's kind of nice. Like once I can travel and get away, it is like a reset. It's like a recharge. There's more stillness. There's not as many like expectations and stuff, where when I'm gone, I can just do stuff that I really enjoy, without like having to tend as much to like my responsibilities. So yeah, I feel like when I come back from a trip, it's actually like better for me at work and as a provider, because I can be a better provider to my patients, and a better leader to my staff, and a better like business owner as well. So yeah, it's really good to just kind of hit that reset button sometimes.
I've also been curious though, culturally.
Yeah.
Because I know a lot of my docs are, without their eye line changing, are always looking at the teeth.
Yeah.
What have you noticed? Have you noticed any sort, and I know it's an obvious answer, but culturally, do you think the U.S. is one of the countries that really values dental care compared to, for instance, other countries? Or what sort of things do you often see without moving your eye line?
Yeah, 100%. I think like we really value the mouth, and not just, it's more like cosmetically how the mouth looks, but I feel like other places I've traveled, there's like different perceptions of beauty, I guess I would say. So like in Europe, like you may not notice as many like straight smiles, and people are kind of okay with that. Like they are more about like taking care of their mouth rather than like how it cosmetically looks. Or in a lot of different areas of the world, I feel like having a space between your teeth is a definition of beauty, whereas like here in America, like we may not see it that way. Like everyone wants to close all the spaces. So yeah, kind of like things like that, where you see there's just different perceptions of beauty around the world. But I think it's also helped me here because like we see a wide variety of people from different cultures, different areas. So you don't want to just like assume everyone wants the same thing out of their dental care. You can kind of tailor it to what they want. And yeah, maybe someone like I'm straightening their teeth, but they want to like keep that gap because they consider it beautiful, and it is. So, you know, I kind of try to take what I've learned outside overseas and like apply it here as well as a provider.
That's awesome.
Yeah.
That's so refreshing because as you said, usually standards of medicine, standards of care, you know, it's cultural too. Oh, we want everything aligned, specific way. We want everything this color, whatever the case may be. So it's refreshing to hear that.
Yeah. Yeah.
So one last question for you, because you are so, it's always refreshing to sit across the table from young docs who are ambitious, who are starting to really enjoy kind of not just being dentists, but also business owners, but also have gotten to a point where they're seasoned enough to say, yeah, it's not easy. If you could give a piece of advice to yourself, essentially when you were an associate to your mom's office initially, what kind of nugget would you give yourself at an early age if you didn't know yourself?
Yeah, probably just, I think a lot of doctors have like imposter syndrome. Like they feel like, what am I doing here? Like I don't belong. Like people are better than me and things like that. And I think it's all about kind of just like learning as much as you can while you're in that associate position. Observing as much as you can, especially if you have like a good mentor or someone to kind of help lead you and guide you. And just, I would say, again, learning as much as you possibly can, not just about how to be a better clinician, but also like if you plan on transitioning into owning a practice or becoming an owner at the current practice, just kind of learning that business side of it too. Yeah, no one teaches us the business side, so that's kind of like a big wake-up call as to we know the clinical skills, but we really don't know the business side. So it's a lot to handle kind of in that sense, transitioning as associate to an owner. But yeah, I would say like just be kind to yourself. Like you are doing better than you think you are. And just try not to like compare yourself to others and just try to be better than you were yesterday and just go from there.
I like that. That's true.
Yeah.
And it's funny you said imposter syndrome, and I started thinking that also applies for that bridge of ownership.
Yeah.
When you're taking that leap from working for someone, taking that mentorship guidance, then you have to put on your boots and say, now I'm in ownership capacity.
Yeah.
How do you make other people feel like you're deserving, for lack of a better term, or that you should have respect, or conversely, that you should be in that position? How do you prove it to yourself? I think we are our worst critics. It's a lot of stress. And I don't think that a lot of small business owners fully grasp that it's okay. You don't need to scrutinize that all the time. You don't need to expand to office 2 or 3 to prove that you're a business owner. You can just keep office 1 and rock it and do your best there.
Yeah, I'm glad you mentioned that because I think when I first came out, I wanted to, like, after a year or 2, jump into, like, a second practice right away. And then I kind of pulled back and I was like, let me just focus on what I have and how I can make it the best it can possibly be. But yeah, it's not always about like how many businesses you own. It's really about like how can you be the best business owner and provider at the business you're at. I think it's a lot like just learning how to lead. Like generally I'm more of like an introvert, so I'm not like out and about like and all of that, but I think if you can just be a good person to your staff and to your patients, it will automatically help you, that will automatically help you kind of rise the business. Like just treating your staff well. Like personally, I don't really try to like micromanage my staff, but I try to guide them in a direction that they like and that they could use. And I think in ways like putting your foot down, but like obviously in a respectful way. And I think if people can sense that aura and that radiation from you,
it'll trickle.
Yeah, exactly.
Yes.
You don't always have to be like, do this, do that, or like, I'm this, I'm that. Like asserting yourself like that. People can like read and feel your energy, patients, and staff all alike. So yeah, I would just say do good by your staff, try to lead well, when you can. And just, this was actually a tip my mom gave me, just like practice in a way that when you put your head down at night, like you're at peace, like, just ethically, morally, empathetically, all of that. So
that's very true.
Yeah.
That's very true. Yeah. Well, that's awesome. And I appreciate your time this morning.
Yeah, thank you for having me. This was fun.
This was fun. If you enjoyed today's episode, be sure to follow and share this podcast with a friend in dentistry. And if you're ready to take the next step in your own entrepreneurial journey, connect with me. I'd love to make your vision a reality. Until next time, keep building, keep growing, and keep practicing your passion.